Hi there, my name is Lorraine Charles Hostin, and today I'm going to talk to you about the QAPI program in the Ambulatory Surgery Center. QAPI is a Quality Assurance Performance Improvement, and that is done every quarter in the facility. Um, so there's a meeting, and the first thing you want to do is to set a date for your meeting. Then you want to notify your committee members. So you have a QAPI committee, and members of that committee could be your administrator, your DON, your medical director, someone from anesthesia, whoever you want to be a part of that committee, including the risk manager. Then you also invite your safety committee members to that meeting, the risk manager as well. Then you call the meeting to order. They do not have to always be present. It can be done on Zoom. It could be done on the phone. Many meetings I've attended, I've called in to the center and done it on the phone. So that's an option. So the first thing you do is you approve the last quarter minutes. Then you get ready to review what's happening in the coming quarter, which is the third quarter. So you can start off with your infection control, where you review surgical site infections and your sterile processing program. Then you have the infection control nurse can come up with a plan, along with the input from others in the meeting to resolve whatever issues might be happening. And that could be done through whatever area that there may be challenges. Chart reviews, you want to review that to make sure that the charts are being reviewed in a timely manner, so that you don't fall behind. Next on the agenda, you follow up on items that may have been added to the audit per Joint Commission, AAAHC, and ACA. And the note about that is if the Joint Commission or AAA or the state comes out and they cite you on something or find some processes, you would then, to correct those processes, send them a plan of correction. So you want to make sure whatever plan of correction that was identified that you've submitted, that you're following through on those plans. You want to review your patient satisfaction surveys, making sure that they're coming back and that any type of grievance is being addressed. You want to have your privacy compliance person check if there were any HIPAA violations, any security breaches. Benchmarking, if you participate with benchmarking, that if you did not meet the standard or if you met the standard, what changes you would need to make so that you could be operating at the level as other surgery centers in your niche. Medication safety, there was an issue with unlabeled syringes, and that was discovered by the consultant pharmacist, and the action that been by the facility to address that. Your patient safety person, they'll talk about their canceled case logs, your variance or incident reports, the studies that were previously completed, they review those, and the current studies that are being done, you review those as well. Your quarterly safety review, if there were any issues, then you would talk about if there are any issues to report and your goals for the next quarter. And here, this particular facility had an annual life safety training coming up, and the meeting is adjourned. That was a really quick overview of what a QAPI meeting agenda looks like. I hope that you find it helpful. And the reason I created this, I've had a few administrators ask me about a real simplified way of doing this. This is what I came up with. However, this is not set in stone. You can create your meeting whichever way that works best for you. This is just a way of doing it that I found to be very simple. And I hope that you find